Nice to meet you. I'm Dr. Ghaffar. How can I help today?
Well, I'm really not quite sure what's the matter with me. I've been feeling really very tired and pains in both of my shoulders, difficulty getting dressed in the morning, which has never been a problem before. I'm a very active person, but this is really, it's a mystery. I don't know quite what's going on, why I'm getting these symptoms, what it could be.
Okay, and just tell me a little bit, how long has this been going on for?
Oh, a few weeks now, and I think it's getting progressively worse.
Right, okay.
Very, very stiff when I'm in bed, and turning over in bed, it's very achy. And I'm feeling quite fatigued as well. Normally I'm out gardening and doing things, walking, but I'm not able at the moment.
This patient is very talkative and is giving a history, and what she's saying is appropriate to the condition. However, you have to be careful with a patient like this who's talkative that they don't go away from the subject at all.
And prior to this, you've never had these sort of symptoms? Or
no, I haven't, no. It's just come on, and it's really bothering me. I don't like to be in pain or not being able to do the things I like to do.
And have you tried taking some painkillers?
Yes, I've tried some analgesics, some paracetamol, but they've had little or no effect. So that's why I've come to see you today.
Right, okay. So you told me a few things about how it's affecting you. Just give me a little bit more of an idea of what sort of activities are you fond of the most, which you can't do?
The doctor originally asked open questions, now starting to ask more close questions, so you can focus more closely on the condition.
Well, my gardening and walking, which I love doing, and it's really put pay to that. Obviously, gardening is a very physical thing, but the movement and the stiffness, it's just really, really bothering me.
It's always important to find out how the illness is affecting the patient, and Dr. Atif does this very well here.
And what about things like bathing and dressing?
Takes so much longer to do that. In the last couple of weeks, my daughter's been down to help me, because I have to have help me get dressed. It takes me so long. But she has a family of her own, so she can't stay and do this all the time. So I'm looking for a solution, to what's wrong.
Okay. Just tell me a few things about your general health. Are you taking any medication at the moment?
Just blood pressure.
Right.
Yes.
And your blood pressure is well controlled according to the records, isn't it? And are there any other ailments and other things wrong at all?
No, I've been generally very, very healthy for my age.
Even though you have a list of previous medical illnesses, it's always a good idea just to clarify this. It often only takes a few seconds, and just make sure that the patient isn't taking any other medication at all.
This sudden onset of the pain and the stiffness in my shoulders and my arms, it's really bothering me.
Of course. You've not noticed any joint swelling or anything like that?
No, not any swelling.
Just want to ask you a few more questions about your symptoms in general. Have you had any severe headaches or any tenderness around the scalp at all?
The doctor now starts to ask red flag questions to exclude temporal arteritis. None
at all, no.
Any aching in your jaw or neck?
No.
And is any pain in the hips at all?
No, perhaps a little, but that might just be because I do a lot of walking or try to do. But the main problem is here in the shoulders, and then it radiates down the arms sometimes, and at night it's particularly uncomfortable.
Does it wake you up at night?
Yes, I wake in night, and it's difficult to get comfortable.
Other than that, your weight has remained stable?
Yes, I'm fine.
Okay. And just a few more questions just about your general health and lifestyle. Yes. I mean, you mentioned you get plenty of exercise usually until this started. Do you drink much alcohol in the week? No, not at all. I do have a glass of wine on a Sunday with my lunch, which is quite nice. Good. Yes. Do you smoke? No, I don't smoke anymore. I used to smoke, but I don't smoke any longer. Good for you. Excellent. And is any family history of any significance? No, not that I can relate to. Okay. So other than this, you're relatively quite fit and healthy? Quite fit and healthy. This has really come as a bit of a bombshell, sort of it's the suddenness of it really over these last few weeks, and I'm wondering what I can do. You mentioned that your daughter's been helping out quite a
Yes,
lot. Is there anyone else that lives at home?
I live with my husband. Okay. Yeah.
And his health is good?
His health is fine. Yes. Yes.
What does he think about all this?
Well, he's as bemused as myself, really, because having always been so healthy, for this to come on suddenly, it's quite disturbing.
Do you mind if we examine you?
Not at all.
Okay.
No, that would be...
I just wanted to make sure there's no tenderness around the scalp.
Yeah, that's fine.
And I just wanted to look at the movements of your shoulders and just
Yes,
make sure there's no tenderness around there.
Yes.
And just make sure you've got no hip pain.
That's fine.
The doctor says that he's going to do an examination and then says what he is going to examine and why. Always be prepared to get up to do the examination, because you might find that the examiner won't give you the information about the examination until you've started to get up to show you're going to do it. Also, it might be an examination case, so be prepared to examine.
Absolutely fine.
Okay. Well, thank you for letting me examine you. Just before we go on to discuss what this is and how we manage this, did you have any thoughts of your own as to what could be causing this?
Not at all, no. I'm completely in the dark as to why I'm getting these symptoms and what it could possibly be.
We all know it's important to ask about the patient's ideas, concerns and expectations, but the skill of a good consultant is to be able to ask it at the appropriate time, and the doctor here does act at a very appropriate and natural time.
Okay. What I suspect you've got is a condition called polymyalgia.
The doctor has finished the history and examination after about 5 minutes, so now has approximately 5 minutes to explain about the management to the patient.
Right.
Have you heard of that?
No, I haven't.
Okay. So basically it's where the muscles and tendons, which are the sort of rubber bands that attach your joints to your muscles, become inflamed and they get aggravated, and that's why you're in so much pain.
Oh, I see, yeah.
And the history that you've given is fairly classical of that, and it can affect your mood and general sort of well-being. It can make you fatigued. And then, as in your particular case, it can be quite debilitating, as you described.
The doctor's giving the explanation here in a simple way without using jargon, and he's also giving it in chunks so that the patient has a chance to respond and he can see the patient's response to what he's saying.
In order to confirm that, often what we do is organise some blood tests.
Oh, I see, yes, that's fine.
So make sure you're not anemic, and also look at what we call inflammatory markers.
It's always important to say exactly what bloods you're going to do, be specific, and also explain why you're going to do them.
Which give us indication as to how much inflammation there is. And often in these cases, the inflammatory markers show that they're quite high. One of the ways we treat this is by using drugs to reduce the inflammation, and those drugs are called steroids.
Steroids? Mm-hmm. That sounds a bit scary.
Yeah, you look a bit perturbed about that.
Yes, what? Steroids, what do they do?
Okay. Well, we're not talking about the sort of steroids bodybuilders use to, bulk up the muscles or anything. So we use steroid drugs at safe doses to just really bring down the amount of inflammation, and often that really helps with the pain. So we start off on 15 milligrams once daily, usually for the first week.
Yes.
And then we taper them down according to the response.
Okay. And is this a long-term thing with the steroids? Will I have to stay on them for a long period of time, or is it a short course? Or
So initially, the most effective dose we use is usually for a week.
Usually you give the steroids in polymyalgia for 3 weeks initially. So I think the doctor here needs to sort of gen up a bit on his clinical management. It's usual to give the steroids for 3 weeks initially. So what's a good idea here is to check on CKS, Clinical Knowledge Summaries, or patient.co.uk how to manage this condition. Have a look after you finish looking at the video.
yes.
But then after that, we tend to taper down the dose over about 2 or 3 month period, because often if we just stop the steroids, the pain can come back with a vengeance.
Oh, I see. Is that just a sort of is it curable, or will it just ease it at the time I'm taking the medication?
Well, often the treatment's very effective for the first few months.
Yes.
The trick then is to try and wean off the steroids gradually to make sure that you're maintaining your function and the pain is well controlled. And in most cases, symptoms do subside, but this can come back with a bit of a vengeance.
So what if I had sort of a maintenance? Is that a maintenance dose? Is that something I've
Yes, so we do sometimes use maintenance doses, and we need to work out what maintenance dose would be best for you long term, but bearing in mind there are other problems associated with long-term use of steroids. So they can thin the bones. We need to make sure the kidneys aren't affected. And all of these are very rare problems. We do need to keep an eye on things.
So would I have to have regular blood tests? Yeah. And then I only have the steroids once the blood tests have been done, and it'll tell you what. Oh, that sounds fine.
The blood tests can be quite useful in terms of telling us how much inflammation there is.
Yes.
Also in conjunction with the sort of symptoms that you're getting. But often what I normally do is I would refer you to see a rheumatologist.
Uncomplicated polymyalgia rheumatica can be managed in primary care, so the doctor here would lose marks for inappropriate referral. There are times that you do need to refer patients with PMR to secondary care, so if you look in the clinical knowledge summaries, you'll find out when this is.
Where they can give us some expert guidance as to what dose of steroid we use and over what sort of period that we use.
I'm prepared to try because, I'm in so much pain and discomfort that, I'll go with it, really.
Well, I'm going to do your prescription to start some oral prednisolone today for the first week, and what I'd like to do is see you next week.
So is that the steroid?
Yes.
Yes.
Just to make sure that things are working, make sure you're okay, make sure the pain's settling down. I'm also going to give you a form to get some blood tests done to look at the inflammatory markers. And then once I've reviewed you, and then we'll refer you then to the rheumatologist so they can come up with a long-term plan and take things.
The doctor here safety nets very well. He tells her about the red flag signs that she needs to look out for. He also makes specific arrangements for follow-up. However, what he could do better is to provide a blue steroid card and to advise her not to stop the steroids abruptly.
From there.
Okay, that sounds fine.
One thing I should add is that if you develop any severe tenderness around the head, severe headache, or any visual problems, or aching of the jaw, then you just need to get back in touch with us. How do you feel about that?
I feel much happier, much happier.
Okay, good.
Yes.
So I'll do the prescription and then we'll arrange to see you next week.
That'll be lovely.
All right, very nice to meet you.
Thank you, Doctor.
So how did Dr. Atif do overall? Well, I'd have given him a clear pass for data gathering and for interpersonal skills, but I'd have to give him a fail for his management and would mark the box inappropriate use of resources on his feedback sheet. However, overall, I'd say, he was a safe doctor, he knew how to manage the condition, but maybe was a bit unsure about some fine details, so I would pass him overall.
Thank you.